You are now listening to Appointment, a podcast dedicated to showcasing the very best direct primary care providers in your community. These guests are taking the initiative to transform how you receive your healthcare services by simplifying the process and improving how healthcare is done. Appointment is sponsored by AppAccess, helping independent healthcare providers and entrepreneurs take control of their online presence by better engaging their mobile audiences no matter where they are. Learn more at appaccessllc.com. I am your host, Jonathan Christopher, and let's get started. In this final part of the interview with Dr. Chad Savage, he discusses some of the things that he's done to build rapport about DPC in his community. We did talk a little bit more about marketing, much more in detail in this episode than last. Let's listen in. DPC community tends to specialize in certain areas of explaining direct primary care. So is that something that you were asked or is something that you took on to yourself?
Yeah, ironically, when I made that conversion originally, I knew I had to make it rationally make sense financially for people. People are very cognizant of their pocketbooks. So I knew right off the bat that we had to make this a financially viable option for people. We couldn't just complain about how, well, I'm burned out, therefore spend money on me directly. That's just not a compelling argument to people. So we had to look at every avenue we had with our diplomas to say, what can we do with a medical degree that we can save people money, because this system is insanely broke. So it's actually not that hard to save money in a system that's so broke like this in the first place. I just kind of did that on my own. I put this little. Actually, I did a conference for my own patients originally. We had several hundred people in an auditorium in my town, and in a real estate building, we had a wedding videographer who came out to videotape it, and I never intended it for wide consumption. I put it up on the net just to show my patients what I was doing, and lo and behold, it started being referenced by national sources as this video about DPC and the finances, and I realized, wow, if in the Remax building basement auditorium and the wedding videographer was something that's like now being referenced as the authoritative financial lecture, and I'm not going to say it was the authoritative, but you get it. It's getting attention. That we have an incredible dearth of this in DPC. So that just was my personal interest. I'm a really weird, nerdy guy who likes numbers, and that works. Phil Eskew's our guy who loves reading insurance contracts. He's the attorney physician who loves doing that stuff. So God bless him. And
I've watched him speak as well.
The innovator, entrepreneurial guys like Umber who really, help figure out how to put a lot of this stuff together. And we've got a diverse group of talented people. And, Julie Gunther is one of the people who just, she puts a human side on it like nobody's business. She can weave the human tale. Well, so there's just a litany of them all, and most of them are passionate about what they're doing and out there talking about it, and we all kind of just fall into our niches. I don't know anybody coordinated it or said this is what you'll be good at. We kind of went around, and since he's doing the nuts and bolts conferences, looked around and said, oh, that person's doing well with the I walk up and people go, oh yeah, you're the financial guy. Okay, I guess so. Now, I never had specific financial training or anything, but was the legal guy and everything else, and he kind of grabbed all these people's different talents and desires and melded them into a conference, which I think is the premier conference in the nation for DPC. It's just such a great environment being there. With regards to
I know you said you were able to carry over some of your patients when you made the transition, but what seemed to work best with regards to marketing?
Yeah, it was face-to-face. It was just, doing presentations and getting out there in the community, and you can't be shy in DPC. It's an unfamiliar model. And people hope that they'll hang their shingle and people will stream to their door, but people say, oh, what's that? I don't know, whatever. They don't bother. They don't think about it. They don't want to think about it. So, getting out there and doing presentations to the Chamber of Commerce and church groups and basically anybody and everybody who will listen, you can get your hair cut and just start talking to the person who's doing your hair and give them a card. It's, anytime people need to be, brave to talk about it. And if you have a passion for it, you can have a quick 30-second It's, hey, it's all your visits, generic drugs, labs, imaging. We'll save you a ton of money, give you better care. I mean, that's, you can get less expensive coverage and save thousands of dollars. It can be as simple as that. And if somebody is looking at you glassy-eyed, has no desire to listen to that, then just talk about your kids in softball or something. Don't push it. But for the people who are interested and they go, what? Oh man, I just got my renewal forms for my insurance, and man, this is getting nuts. And
yeah.
Okay, and you have to be careful to preface it and say, listen, I'm not a financial planner, I'm not an insurance agent, but here's some ideas. There are things, coverage options that people don't even know about, like the health sharing organizations that are the price of traditional insurance, and they work exceedingly well with direct primary care. So yeah, just mainly getting out there and at least for me, everybody's a little different, but getting out there and talking. And
sure. It seems like it would be there would be more hoops in terms of getting a business on board for its employees than it would be for an individual or a family.
Absolutely. Mainly big businesses. I think that's the thing that most people in DPC keep thinking about and trying to. I'll be honest, I like the onesies and twosies. I like people deciding for themselves. I get worried about being too beholden to one payer source.
Right.
What if they decide to bail on you? Then you get it could yank out the rug from your practice. We want to make all our patients happy, but then you can't make everybody happy. So if a couple of people decide this just isn't for them, but that's okay. We wish them well, and they move on to whatever it is, the practice that they're more comfortable with, and we're not financially destroyed by losing a few patients here or there. But by making the vast majority of them happy, we're proving our success, and they're voting with their own dollars.
Mm-hmm. I've heard a lot of discussion about Amazon and Jeff Bezos making moves and being concerned about the cost of healthcare. It would be sweet if eventually, there'd be a sit down with him and say like, hey, so tell us what your challenges are, Funny,
because I think he's going in the wrong direction. I understand he's trying. But I think he's talking to the people who are currently making it expensive to find out how you don't make it inexpensive, as I understand it.
Okay.
If he was really, but I don't know how somebody at that high of a level, sees what's going down here on the grassroots. But I think if he saw what was going on, he would realize he's talking to the wrong people.
Right.
That it can be achieved. It absolutely. In fact, he's insanely innovative. Amazon is incredible.
Yeah, they are. Don't worry. I'm going to send him a Christmas card, and we're going to get on this.
You got you in with him, man. Set now.
It seems like you put a lot of thought into, diabetes, treating diabetes with your practice. Was that one of the more central aspects as to what you wanted to provide for your patient?
Yeah, I'm an internist, so I see primarily adults, and I tend to see a lot of complex disorders. Actually, I think I see more complex patients now than I did when I was insurance-based, because the people who say, oh, unlimited visits, that's awesome, I'm there every other week, that's a good deal for me. We actually skew towards the sick. Now, we need to make it enticing for people who aren't sick, too, to be viable as a practice model. But yeah, I remember specifically, I was in the insurance model, and I was sitting with a patient who had a complex, diabetic issue, and we were talking about all the plans, and we'll try this, we'll do this and this other thing, and finally we agree on the plan. I look at her, does that sound good to you? She shakes her head. She it's good to me. Okay, great. And then shake her hand, start heading out the door, and she stops. She goes, oh, doc. I say, yeah. She goes, well, how do I afford all that? And I thought about it, and I go, I don't know. Well, good luck with that. And I went out the door. And I thought, this is horrible. I have no idea how to help this poor woman.
Right.
And so then, in this model, people start saying, how do you afford it? And we actually can tailor a plan for them to try to make it. And we can't control everything. There's branded drugs that are expensive, and there's some movement to try to see if that could be achieved at a lower rate. But there are ways of kind of, if you understand the resources in your community and that are available to you, that you can even manage diabetes at a fairly inexpensive cost, and that is vital. People lose limbs, they go blind, they end up on dialysis and die from heart attacks from not treating diabetes. So it's imperative, and that's as more and more people are becoming diabetic with our growing population, if you will, in the United States. That's a huge financial strain on our support networks, our healthcare system. So we've got to figure out how to handle this in a cost-effective manner.
Right. What are some of the, first symptoms of somebody maybe being pre-diabetic, maybe?
Yeah, well, that's the problem is a lot of times with diabetes, you don't feel anything until it's too late. You know, the first thing you could feel could be losing your vision or developing a neuropathy, which are advanced states, as you're probably aware from your PA training, polyuria, peeing a lot. That would be probably one of the few things that someone may notice early. So getting screened is a great idea. Well, we can do a hemoglobin A1C, a 3-month sugar average for about $4. So now suddenly checking for that is insanely inexpensive, where someone may forego even finding out if they have it because they can't afford the screen, so we can do a physical exam battery, which is a CMP, a comprehensive metabolic panel, kidney function, salt levels, sugar levels. We can do a CBC, which is your blood counts, looking for anemia, platelet counts, immune cells, thyroid level, cholesterol panel. We can do all of that, and it's about $23 or so. So I mean, the same panel of testing is around $500 through the neighboring university hospital system next to my practice here. So
that's amazing.
Being able to afford it and do it, and not be able to afford it, and people can say, well, that's you could get it over there, but if you really can't pay for it, then that's a hypothetical and nice wish, but not a reality for these people.
Exactly. Well, Doctor, you've been wonderful. I really can't thank you enough. Where would people be able to find more about you and your practice if they were in your area listening to this?
Certainly. So we have a website, www.yourchoicedirectcare, all one word, yourchoicedirectcare.com. For finding a local practice, there's no one individual site that shows all DPCs, because we're all a bunch of, it's like herding cats. We're all these individual practices out there. But DPC Frontier, I can't remember where it's .org or .com, but anyway, Phil Eskew's website has a mapper feature that has a lot of the DPC practices. And then, honestly, if someone just wants to learn about this movement in general, the Docs for Patient Care website has links to that conference, and you can watch the videos as I know you did. And that's a great way of really getting a fairly comprehensive understanding of the DPC movement.
Well, that's great. Thank you so much again, Doctor. I look forward to keeping in touch with you, and I look forward to seeing this movement progress and, reach more people, especially in underserved communities, which is why I actually am pursuing the physician assistant degree that I am.
Actually, if I can give him a plug, look at what Paul Thomas is doing in Detroit with that.
I love Paul.
There, yeah,
he's everywhere. I see him everywhere. I turn on everything and I see Paul left.
Social media thing down. So,
I'm going to track him down eventually.
Doing exactly that, and I'm so happy and proud of what he's doing. Showing that you can give great medical care to what historically are underserved communities, and you can do that rural. You can do that in urban areas, and so it's the big fallacy is that this is a movement for the rich. This is actually a movement to make it affordable for anyone.
So there you have it. My first interview with my first guest, Dr. Chad Savage. Thank you so much. I look forward to continuing the series and meeting more primary care physicians and physician assistants. See you next time.